Dementia is a general term used to describe the symptoms of mental decline that accompany Alzheimer's and other brain diseases. It's characterized by dysfunction or loss of memory, orientation, attention, language, judgment, and reasoning. Patients with dementia will exhibit personality changes and behavioral problems such as agitation, delusions, and hallucinations. 15% of older Americans have some form of dementia, and this is increasing as the age of the population increases. About half of all residents in long-term care facilities have some form of dementia. As the average lifespan increases, the number of those affected with dementia is also going to increase. There are numerous causes of dementia, as many as over 100. Some examples of some causes of dementia are listed here on the slide. The first set of examples we have are what's known as neurodegenerative diseases. These include things such as Alzheimer's disease, Down syndrome, amyotrophic lateral sclerosis, and Huntington's disease. A CVA or a stroke is also another possible cause of dementia developing in an individual. We can additionally see dementia develop in relation to immunologic diseases or infections, such as meningitis or even lupus. Some other reasons that dementia can also occur would be possibly due to trauma or tumors of the brain tissue, hydrocephalus, and certain medications. Oftentimes, when the cause is neurologic degeneration, the symptoms are going to be of a more gradual onset. If the dementia is occurring as a result of vascular injury or infection, generally the symptoms will occur more abruptly and will worsen much more quickly. Alzheimer's is the most common cause of dementia, with about 60 to 80% of patients diagnosed with dementia also being diagnosed with Alzheimer's disease as the cause for their dementia. Progression with Alzheimer's disease varies from person to person and ranges anywhere from 4 to 8 years. However, some individuals can live as long as 20 years. What we do know about Alzheimer's disease is that it is progressive. We don't have anything available to us in the means of treatments that can slow down the disease progression, and this is not a curable disease. The patient will continue to experience degeneration of their neurologic function as time goes on. Alzheimer's disease most commonly affects individuals over age 65. When Alzheimer's disease occurs in an individual under age 65, we term this early onset Alzheimer's. Generally, if early onset Alzheimer's occurs in an individual, we look for any sort of familial links with that individual. This is because we have found that there are genetic characteristics present in individuals that exhibit early onset Alzheimer's, and children of parents with early Alzheimer's have a 50% risk of developing the disorder as well. Therefore, genetic counseling for any families who have individuals with early onset Alzheimer's being diagnosed, genetic counseling is appropriate for these families. Alzheimer's is often diagnosed once 2 or more brain functions are significantly impaired. There is no single diagnostic test that can determine if a person has Alzheimer's disease. Physicians, oftentimes with the help of specialists, use a variety of approaches and tools to help make their diagnosis. Although physicians can almost always determine that a person has dementia, what can be hard for them to determine is the exact cause of the dementia. Therefore, a variety of approaches are going to be included in the diagnostic process. The first thing that's going to be looked at is the patient's medical history. The physician is going to want a thorough evaluation of their psychiatric history and any history of cognitive or behavioral changes that the patient may have exhibited. They also will want to know if any other family members have had a history of Alzheimer's disease or any other type of dementia. In regards to the physical examination, they're going to collect a variety of information to try to identify any health issues that could potentially be causing the symptoms of dementia that have the potential to be reversed if there was a treatment for that disorder. Moving on to the neurological exam, the physician would evaluate the person for any problems that may signal any other type of brain disorder other than Alzheimer's. The doctor will look for any signs of a small or a large stroke. They might look for Parkinson's disease, brain tumors, a fluid accumulation on the brain, anything that has the potential to impair memory or thinking. To do this, a complete neurological assessment is necessary to evaluate the patient, and this would include reflex testing, coordination and balance testing, motor testing, sensory testing, and the mental status testing, as well as all of the cranial nerve testing. Ultimately, the physician's goal with both the physical examination and the neurological specific examination is to try and rule out any possible disease process that could be causing the dementia. Ruling in Alzheimer's disease is going to be a final stop in the diagnostic workup. Lastly, with this diagnostic workup, we would also include imaging studies such as a CAT scan or an MRI to look for changes in the brain. These tests are primarily also used to rule out other conditions that may be causing the symptoms similar to Alzheimer's, because the CT or the MRI can reveal for us tumors, it can reveal those strokes, any damage maybe due to head trauma. Obviously, these would be able to reveal to us a buildup of fluid in the brain. So again, even with the imaging studies, one of the first approaches that the physician is taking is to try and rule out any other disease process that could be causing the signs and symptoms of dementia that the patient is experiencing. However, there is one other thing that the MRI is capable of doing, and with this test, they can find out if the individual has high levels of a substance known as beta amyloid, which is a hallmark of Alzheimer's disease. If the patient shows normal levels of beta amyloid on the MRI, it would suggest that Alzheimer's is actually not the cause of the dementia. It's important to note that pathologic changes often precede the clinical manifestations of dementia by anywhere from 5 to 20 years. Changes in the brain related to Alzheimer's disease can begin years before the signs of the disease actually show. When looking at the clinical presentation of Alzheimer's disease, we break it into 3 stages: mild, moderate, and severe. We see a different set of symptoms develop in each of the stages. It is important to note that there can be some overlap from one stage to the next. As a patient progresses, for example, from mild to moderate, they may still be displaying several characteristics of the mild stage of Alzheimer's while beginning to display characteristics of the moderate stage at the same time. Something that we see consistently present across the stages is a term known as retrogenesis. This is a process where the degenerative changes occur in reverse order to which they were acquired. An example of this would be comparing the developmental stages in children with the deterioration of an Alzheimer's disease patient. And what this means is that in Alzheimer's disease, the memory loss initially relates to the most recent events, with remote memories intact. So in the earlier stages, such as the mild stage, they're going to be losing more of their short-term memory while their long-term memory remains intact. However, with time and progression of the Alzheimer's disease, their memory loss will expand to include both their recent and their remote memory. So looking first at the mild stage of Alzheimer's disease. In the early stage of Alzheimer's, the person is likely still functioning independently. He or she may still be driving, they may be working, and even a part of social activities. Despite their active lifestyle, they may begin to notice that they are having memory lapses. They may notice that they're forgetting familiar words or the location of an everyday object. Their friends and family may also start to notice the difficulties. Some common characteristics noted in the mild stage would be, as mentioned, forgetfulness beyond what is normal. They might have problems coming up with the right word or the right name. They're going to have trouble remembering names of people when they're introduced to someone new. And they'll even notice that they begin to forget material that they've just read. They're also going to notice problems with solving simple math problems. Any kind of challenging task that they might have to do in a social or work setting. They also will begin to notice problems with their ability to plan and organize in this first stage. The moderate stage of Alzheimer's is typically the longest. The dementia symptoms become more pronounced. The person begins to have greater difficulty performing tasks, such as paying bills. They still are usually able to remember significant details of their life as they move into the moderate stage of Alzheimer's. As the disease progresses throughout the moderate stage, they are going to begin to require a greater level of care. They are also going to begin confusing words, getting frustrated or angry, and even acting in unexpected ways, such as refusing to bathe. As they move through the moderate stage, the damage being done to the nerve cells in the brain will even begin to make it difficult for them to express their thoughts and perform routine tasks. At this point, the symptoms will be very noticeable to others. Their memory loss and confusion are going to become more obvious. They're going to be confused often about where they are and what day it is. They're going to be unable to recall their own address or telephone number. They may not be able to recall their high school or the college from which they graduated. They're also going to start needing help getting dressed in the moderate stage. They're likely not going to be able to choose proper clothing for a season or occasion. Occasional incontinence is also something that begins to present within the moderate stage. They'll have trouble controlling their bladder and bowels. In some individuals, not necessarily in all individuals during the moderate stage. Forgetfulness of events or their own personal history becomes common in the moderate stage, even forgetting the names of close friends and families. They do begin to have difficulty sleeping. They may begin to sleep more during the day and be restless at night. Behavior problems also start to present in the moderate stage. This can be where they are going to be at the highest risk for wandering and likely becoming lost. They may also feel moody or withdrawn, especially if they're placed in any type of a social or mentally challenging situation. Some other issues that will start to arise in the moderate stage is going to be the personality and behavior changes. They may become suspicious, start to have delusions, become more compulsive, and start to perform repetitive behaviors like hand wringing or tissue shredding. In the severe stage of Alzheimer's disease, also known as the late stage, the dementia symptoms are going to be the most severe. At this point, the individual is going to lose the ability to respond to their environment. They'll lose the ability to carry on a conversation and eventually to control any of their movements. As their memory and cognitive skills continue to worsen, they will start to display significant personality changes, and they're going to need extensive assistance with their ADLs at this point. They're going to lose awareness of any recent experiences and even lose an awareness of their surroundings. They're going to need round-the-clock care and assistance with those ADLs because they're going to lose the ability to complete them on their own. They will begin to have an impaired ability to speak during the severe stage. At first, it may just be difficulty communicating until eventually they will be unable to communicate at all, and eventually the patient will become unresponsive. As the severe stage progresses on, they're going to have difficulty eating and swallowing, and then even difficulty walking or sitting without help. In looking at the collaborative care for Alzheimer's disease, the first thing we're going to take a look at is the pharmacotherapy available to support the various cognitive problems. Although the Alzheimer's disease cannot be stopped or reversed, an early diagnosis and early treatment can allow the person to live as well as possible for as long as possible with the disease, also providing them with time to plan for their future. So in the early to moderate stages of treatment, the first group of medications that we're going to look at is the cholinesterase inhibitors. Donepezil, otherwise known as Aricept, is one of the most common drugs administered in this classification. They are prescribed to treat symptoms related to memory, thinking, language, judgment, and other thought processes. For moderate to severe stage Alzheimer's, we can move into the NMDA receptor antagonist. Memantine is the most common drug in this class administered for moderate to severe stage treatment of Alzheimer's. This is prescribed to improve their memory, their attention, reasoning, language, and help with their ability to perform simple tasks. It can be prescribed alone, but it's oftentimes prescribed in combination with other Alzheimer's medications, generally from the cholinesterase inhibitors group. Some other medications that are also going to likely be prescribed for the Alzheimer's patient would be antidepressant therapy. These are going to help with the patient's mood and irritability. Some common antidepressants used for Alzheimer's patients would be citalopram, fluoxetine, and sertraline. As the disease progresses, at some point, antipsychotic medications are going to be added to the pharmacological regimen. They're going to be used for the management of the patient's behavioral problems, such as their hallucinations, delusions, aggression, and agitation, even the uncooperativeness that oftentimes occurs, especially in that late stage Alzheimer's patient. Some common antipsychotics used for the Alzheimer's patients include haloperidol, olanzapine, and aripiprazole. Another classification of medications used for these patients are going to be the sedative hypnotics. And this is because people with Alzheimer's disease often have problems with sleeping and experience changes in their sleep schedule. One of the most common ones that we would see administered for this problem is going to be zolpidem or Ambien. Another major treatment approach with the Alzheimer's disease patient, in addition to the pharmacotherapy, is their behavior modification approaches. This is going to be some non-pharmacological approaches that can be taken to manage the patient's behavior issues. Some great examples of approaches that can be used here for behavior modification include things like monitoring the patient's personal comfort, so being proactive with checking for pain, hunger, thirst, a full bladder, maintaining a comfortable room temperature for the patient. So that our first approach is really just to be proactive and anticipate things that might frustrate or irritate the Alzheimer's patient. The second approach is to avoid being confrontational or arguing about facts. For example, if a person expresses a wish to go visit a parent who died years ago, you don't need to point out that the parent is dead. Instead, simply say, "Your mother is a wonderful person. I would like to go see her too." Another common behavior modification approach is to redirect the person's attention. Try to remain flexible, patient, and supportive, and respond to the patient's emotion and not necessarily to their behavior. You also want to create a calm environment. We try to avoid excess noise, glare, or too much background distractions. Even televisions with the Alzheimer's patient can be very distracting. Another approach that's also oftentimes successful is to provide the patient with a security object, something that they're very comfortable with, they likely become very attached to, and that we can allow them to keep with them. One final approach with behavior modification would be to acknowledge a patient's request when they do ask for something and respond to them rather than to just ignore their request.